Hey guys, this is Dr. Sean, and today we got
Dr. Johnpion.
and we're from Hilton Physical Therapy. Today we're going to be doing a special video. We're going to be talking about dry needling. We're going to first talk about the benefits and who would be appropriate for this kind of treatment, and then we'll actually do a treatment today on Dr. John on his neck. John, what do you think some of the benefits are of this dry needling?
Well, first of all, definitely pain, in terms of treating pain, joint immobility, muscle pain, muscle tightness, any kind of decreased range of motion that you may have. Do you have anything else, Sean?
Yeah, I think we've definitely noticed that this treatment technique is really beneficial for athletes, especially. With people in their sport, they definitely get a lot of acute tightness, and this is a really immediate relief for a lot of our athletes, tennis players, baseball players, etc. But it's also definitely beneficial for older population too, right?
Mm-hmm. Joint arthritis too as well, just generalized low back pain, cervicalgia, neck pain too.
Yeah, I feel like we treat a lot of necks and low backs with this dry needling, and people coming in with acute low back pain, this is definitely a big benefit for them to expedite their recovery. And also we've also found some research that this is helpful for people who have neuropathy too in their feet. Kind of helps to get their sensory feedback a little bit better, right? So they can feel their feet again when they're walking. And I think some research too for people with Parkinson's, they can help a little bit with their rigidity, help them move a little bit better so they're less stiff. So how does this help our patients?
So here's the general concept of dry needling. So we use the same tools as acupuncture. And the principle of dry needling is to help develop tissue that's really tight or banded together. So this tissue is contracted, it's shortened, it's not returning to its normal length, and that leads to joint pain, tightness, decreased range of motion. So what happens is when you feed that needle into the muscle, you develop a twitch response, and the muscle grabs through the needle. It's going to hold to it. You almost feel like a toothache or achy sensation for a little bit, and then that muscle releases, and the muscle finally gets to its normal length. So it helps get to its normal length, and then it also helps neurologically from the brain to help fire to that motor unit, and kind of return that neurologically back too.
Yeah, another thing I'd like to add to that too is it actually really helps with improving circulation and bringing oxygen to that area. So when we have tight bands of tissue, what we like to call trigger points, there's a lack of circulation in that area, there's no oxygen in that area, so there's no ability for that tissue to recover and heal. So when we actually use the dry needles to treat that area, again, now we're getting oxygen, we're getting circulation in that area, and like John was saying, that trigger point releases, so that band of tissue is now, the fibers are nice and aligned so that you can get that flexibility and mobility you need to get back to your sport or get back to whatever activity you're limited from. So, anything else, John?
I think that's it. So what we're going to do is kind of show you guys the technique of dry needling, and Sean's going to dry needle my upper trap, and we should be able to get a good twitch response from that.
Yeah. And for you guys that are friends with John on Snapchat, especially in Pittsburgh, this is my way of getting back to John all the times he scared me in the clinic, so this is going to be a lot of fun. I'm just kidding, this does not hurt.
Alright, so I'll grab the camera here.
Okay.
And Sean's just getting some gloves on. He's going to wipe me down with some alcohol.
Okay. Okay, so we're going to feel around here. Let's try to feel for those tight bands. Okay, John, you've been getting some neck pain a little bit?
Just a little bit of tightness.
Okay. So I'm feeling some tightness right there. Does that feel?
Yeah.
Okay, so we're going to get that area first. Okay. Okay. Oh yeah, they're feeling. I don't know if you can see it on camera, but I definitely felt a twitch there. So we're kind of scanning the area here. John, what do you feel?
So I definitely feel that needle grab into it a little bit.
Okay.
What Sean's doing right now is called scanning with the needle. So he's looking for tight bands of tissue.
Okay. Okay. So I'm going to twist that needle. I would twist that needle, and if we were doing an actual treatment, we would leave that in there for a few minutes to let that tissue release, okay? To get those fibers aligned. But today, since we're just showing you guys for a demo, we're going to take that back out. Okay. Do one more, kind of see if we can get another response there.
Try going just a little bit higher on this one here.
Okay. Right there, John?
Mm-hmm. Yeah, that should be good right there.
Switch my hands here for this one. I guess the camera won't be able to see that way though. Okay.
See if we can get a good trigger. Well, there we go.
So we get them scanning that area. Ooh. Oh, there we go.
That's a
Did
good
we-
twitch
did we get that on
response,
camera there?
I hope so.
Yeah. Yeah.
So Sean just got a really good twitch response from hitting a trigger point there. A trigger point's just a really tight band of tissue.
So I'm gonna kind of pack that a little bit so we get any more responses there in that area.
Mm-hmm.
Feel a little smaller ones, not
So
enough to pick up on the camera, but there's some smaller ones.
Yeah.
Going on. Oh, there we go.
Got a really good achy sensation right now going.
And sometimes what we do is we'll twist the needle a little bit to kind of really engage that connective tissue to get that
And then
tissue to ravel around the
show
needle.
him if it's grabbing, how it really grabs at that tissue. So Sean, if it's really grabbing, which it should be right now, you can tell if Sean's trying to pull that needle out, it's not going anywhere because that fascia is really grabbing at the needle.
Right there, yeah. And again, if this is an actual treatment, we may leave that in there for 5 minutes or so. Okay. So we'll take that out. Okay.
All right.
And sometimes you get a little bit of a little spot of blood, but there's a little bit right there. We just wipe that off and it's all good.
Mm-hmm. You can try one more, Sean?
You want me to do your
Wrap
other
it
side,
up.
or?
No, I think we're good.
Okay. I think we're good. I think they get the idea.
Mm-hmm.
I guess what we'll end with, one other nice conjunction that we sometimes do in addition to this treatment is we'll actually add electrical stimulation to those needles. We'll actually stimulate those needles to get electrical impulses in that area. And what that does, it actually enables the body to release its natural own painkillers called endogenous opioids. And that really helps to get some really good pain relief for a longer duration after you guys leave the clinic. Right?
Mm-hmm.
So, all right, guys. Well, thank you very much. If you have any questions, please leave them on the comments for Facebook or Instagram, or feel free to send us an email, and we'll love to have a discussion with you guys more about this treatment.
Yep. Have a great day.
Have a great day, guys.
Be
Thanks.
safe. Thanks.
We'll see you next week.